you all on today's webinar on New Lines of Approach to Agadtantra, organized by Department of Agadtantra, Dr. G.D. Ford Foundation, YMT Ayurvedic Medical College and Hospital, Navi Mumbai. Before proceeding further, let's pray to Lord Dhanvantari on the occasion of the webinar. So I request Dr. Chaitali Kulkarni to chant the Dhanvantari Stavam.
धन्वन्तरे गरुचि धन्वन्तरे ऋतरु धन्वन्तरे भवसुधा धान्वन्तरावसथ मन्वन्तराधिकृत तन्वन्तरौषधनिधे धन्वन्तरङ्गशृगु धन्वन्तमाजिषु वितन्वन्माब्धितनया सून्वन्तकात्मकृत तन्वन्तरावयव तन्वन्तरात्रिजलधौ चन्द्रौघकान्तिममृतात्मकरैर्जगन्ति सञ्जीवयन्तममितात्मसुखं परेशं ज्ञानं सुधाकलशमेव च सन्दधानं शीतांशुमण्डलगतं स्मरतात्मसंस्थां मूर्ध्नि स्थितादमुद एव सुधां स्रवन्तं भ्रूमध्यगाच्च तत एव च तालुसंस्थात् हार्दाच्च नाभिसदनादधरस्थिताच्च ध्यात्वाभिपूरिततनुर्दुरितन्निहन्यात् अज्ञानदुःखभयरोगमहाविषाणि योगो यमाशु विनिहन्ति सुखं च दद्यात् यन्मादविभ्रमहरः परतश्च सान्द्र स्वानन्दमेव पदमापयति स्म नित्यं ध्यात्वैव हस्ततलगं स्वमृतं स्रवन्तम् एवं स यस्य शिरसि स्वकरन्निधाय आवर्तयन्मनुमिमं स तु वीतरोगः पापदपैति मनसा यदि भक्तिनम्रः ॐ श्री धन्वन्तरये नमः।
Thank you, Dr. Chaitali. Friends, Ayurveda plays a pivotal role to augment, cure, and measure for many diseases. Utility of subject Agadtantra is being established with its classical knowledge, experiences from clinical practices, empirical evidences, and emerging trends of ongoing clinical studies. We are sure that new lines of approach to Agadtantra will definitely put light on current issues. Now, without further ado, we will turn the time over to today's speakers. Our first speaker is Dr. Vishnu Zogrekar sir. Welcome, sir. He is going to talk on COVID-19 review through spectrum of Agadtantra. I'll briefly introduce him. Dr. Vishnu Zogrekar is a former head of the department and professor of Agadtantra department, Tiyak Ayurved Mahavidyalaya, Pune. In his long academic career, Sir has taught many subjects. He has been working as editorial and review board member of JAIM. He was executive editor of textbook of Agadtantra, sponsored by Ministry of Ayush. Currently, he is an advisor to Ayush COE at CCIH, Savitribai Phule Pune University. So I request Dr. Zogrekar sir to start the lecture. There is a small announcement. Please, there is a question answer session is kept after each lecture. And if anyone has queries or questions, they can ask the questions after the lecture. They can also type their questions in comment box. Thank you. You can start with your lecture, sir. Thank you.
Hello, am I audible? Hello, am I audible?
Yes, sir.
Yeah. Do you see my screen? Hello,
Hello?
is my slide
Yes,
visible?
your slide is viewable on screen, sir.
Okay. So today we are going to talk about COVID-19 from Agadtantra perspective. Here I am not taking a Vishatantra perspective, but a perspective from Agadtantra, Vyavahara, Ayurveda and Vidya. So let's begin. We are going to covering many topics. First is Visha Vyanjana, then Nidana Vishesh, Purvaroop, Roop, Upashaya Anupashaya, and Samprapti of COVID-19. Then we are going to look at documentation for COVID-19 patients. We are going to go through rapidly standard guidelines of ICMR for management of COVID. We are also going to see.
Jovekar sir,
Huh?
sorry to interrupt. There is one request. Slightly. Uh, Hello,
Huh?
sir. Your sound is very low. Please increase your sound.
Uh, Hello.
हाँ sir.
Am I audible?
Yes, yes sir.
Okay. So after looking at ICMR guidelines, we are going to go through Ayush guidelines, then the guidelines regarding handling of the body and the autopsy. We are also going to look at epidemic act which is in place, and lastly we are going to look at some of the vaccines. So the topic is huge, so I am not going to go into too many details. Um, so let us start first with Vyanjana. As we all know, in Sushruta Samhita, the definition of Agadha Tantra includes Visha Vyanjanartham. So the word Vyanjana means chinha or identity. For any kind of Visha, the definition is Vishada Jananad Visham. As we know, Vishad means avasad or jadata or despair, sense of there is no future, all hope is lost. That kind of feeling is called as despair, and COVID 19 has caused extreme despair in this world. The way it has progressed from a few cases in Wuhan, China, to everywhere on the globe, now the second wave is coming. So it has caused extreme despair. And by definition, we can say that COVID 19, the positive factor coronavirus, SARS coronavirus 2, uh, can be labeled as Visha. Now, once we label it as Visha, we want to know which kind of Visha. So, um, excuse me, sir, can I speak in Marathi? Hello,
Yes, sir.
can I speak in Marathi?
Sir, if possible, try to speak in Hindi and English as there are delegates from outside of Maharashtra also.
Okay, no problem. Uh, some of my slides have Marathi
Yes, sir, but
sentences.
yes, try to, sir, try to explain in Hindi and English as there is
Okay,
audience
no
from
problem.
out of Maharashtra.
No problem.
Thank you, sir.
So, the first question is which type of Visha is this? Is it Sthavara? The way it is spreading, we cannot call it as Sthavara. Is it Jangama? The virus is live only when it is in a cell, inside a cell. If it is outside the cell, it is a non-living particle. So we cannot label it as Jangama also. Can we call it as Garavisha? There are various definitions of Garavisha, and mm, we can put it in Garavisha category by some definitions. But the common meaning of Garavisha is taken as Sanyogaja Visha, and COVID-19 is definitely not a Sanyoga, so it is not a Garavisha. Is it Dushi Visha? We cannot say just now because Dushi Visha is a long-standing chronic poison. Kaphavratam Varsha Gananubandhi, and currently we cannot say about Varsha Gananubandhi because the virus is new. 1 year is yet to be completed. In December, there will be the happy birthday of maybe unhappy birthday of COVID-19. So, is it a Krutrima Visha? Definitely. It is rumored that this virus was manufactured in a laboratory in Wuhan. So, for the time being, we can label it as Krutrima Visha. Now, we will look at the Nidana Vishesh. In December 2019, 1 year back, a previously unidentified coronavirus, which is currently named as 2019 novel coronavirus, emerged from Wuhan, China. Now, coronaviruses are so called because electron microscopic picture of these viruses looks like a crown, and Latin word for crown is corona. So, a class of viruses or a family of viruses which has such features, its external surface looks like a crown. It is called as coronavirus. Uh, it is a class of viruses, and recently, from 1976, where first coronavirus disease was identified in Bahamas, Bahama Island archipelago. In that, there was a convention of legionaries, And in this convention, a new disease was observed, and the causative factor was identified as a new virus, novel virus, and its shape was like a crown. So it was termed as coronavirus. The first epidemic due to coronavirus was in 1976. After that, many coronaviruses have come. SARS and MERS are two notable epidemics, and currently it's COVID-19. It was an epidemic. The first case emerged in December in Wuhan, and then it was outbreak in many cities in China. Then it extended globally, including Thailand, Korea, Japan, United States, Europe, Philippines, Vietnam, and obviously India. Now, usually in epidemics, we look for the first case or patient zero. In case of COVID-19, patient zero has not been identified, but data analysis has revealed the genome of mother of all SARS-CoV-2 genomes. This is an RNA virus, so this RNA strand inside the virus is its genome, and mother of all this SARS-CoV-2 genomes is identified using computational biology, and this data analysis has identified this mother of all genomes very recently. I have read this paper just 2 days back on Saturday. On Sunday, this paper was published. To continue with Nidan, disease is officially named as coronavirus disease 2019 or COVID-19 by WHO on 11th of February 2020. But before that, it was named by CDC, Center of Disease Control Taiwan, as severe pneumonia with novel pathogens. And this nomenclature was pronounced on January 15th. After that, WHO renamed it as COVID-19. Now, this is a globally notifiable communicable disease. Now, not every disease is notifiable, but this COVID-19 has been declared as notifiable disease. That means every diagnosed case, the information should reach the health authorities in the country and also WHO. So it is globally notifiable disease, and that's why in many places when any private lab tests a patient, if the result is positive for the virus, then it is communicated to the health authority before it is communicated to the patient. मरीज को इन्फॉर्म करने से पहले कॉरपोरेशन या लोकल जो हेल्थ अथॉरिटी होती है उनके पास इसकी जानकारी दी जाती है। ऐसा होने से क्या होता है कि जो हेल्थ अथॉरिटी है वो आगे के स्टेप्स ले सकती है, यानी कि कॉन्टैक्ट ट्रेसिंग वगैरह ये सब काम शुरू हो जाते हैं। Origin of this disease is supposed to be from bats, जो मराठी में जिसे वटवाहुड़ कहते हैं, गीदड़, ये गीदड़ के तरफ से आया है, ऐसा ऐसी अभी की जानकारी है। मॉर्टेलिटी रेट पहले बहुत ज्यादा था, क्योंकि पहले इसका इलाज कैसे करें ये कुछ पता नहीं था, बिल्कुल ही पता नहीं था। तो पहले ज्यादा मॉर्टेलिटीज थी, लेकिन अभी ग्लोबली ये 2 to 5% पे सेट हो गई। पर्सन टू पर्सन ट्रांसमिशन may occur through droplet or contact transmission. So person to person transmission is possible by hugging, kissing, or sexual intercourse. Particularly exchange of body fluids, particularly saliva, because it is essentially spreads through respiratory system. The sneezing and coughing produces droplets which contain virus particles, and these droplets will transmit the disease. Stringent infection control is essential, particularly for first line healthcare workers, people who take the samples, people who handle the biomedical waste from the patient, people who touch the patient in any capacity. All these should take precautions. There is no definitive treatment for COVID-19 as of today. All the drugs which have been promoted are found to be not effective. Previously, it was hydroxychloroquine, then remdesivir, then favipiravir, then ivermectin, then Ayush Kadha, and many drugs were promoted, but no drug is definitely effective on COVID-19. Many of the drugs are under investigation. Ayurvedic drugs show a remarkable trend uh, towards success, but it has to be proven statistically, and it is yet to be published. Now, this is the observed case fatality ratio. In Mexico, it is maximum 9.9%, whereas in India it is 1.9%, and the two countries which have still lower rate are Poland and Czech Republic. Deaths per population, again, per 100,000 पॉपुलेशन, 1 लाख लोगों में कितने लोगों की मौत होती है, ये देखा तो बेल्जियम में सबसे ज्यादा है, स्पेन में उससे थोड़ा कम है, इंडिया का नंबर बॉटम में है। यहाँ पॉपुलेशन के हिसाब से 1 लाख लोगों में सिर्फ 9 लोगों की मृत्यु कोविड-19 से हो रही है। और ये अचीवमेंट इंडिया के लिए बहुत बढ़िया है, क्योंकि अगर यहाँ का रेट ये suppose it was like Belgium, then the deaths alone in India would have crossed 1 crore marks. Now, the presentation of disease, we all know, can be in 3 stages: mild, severe, moderate. There are many asymptomatic positive patients also. Uh, in asymptomatic patients, generally only symptoms that present uh, are malaise, vague aches and pains, um, slight loss of smell, etc. Usually, these symptoms occur 1 or 2 days before full-fledged infection, full-fledged disease is seen. In mild disease, pneumonia may be there, may not be there, and fever, cough, chills, these are the usual symptoms. In severe disease, dyspnea with respiratory rate more than 30 per minute and blood oxygen saturation less than 93. Now, important to note is the happy hypoxia, where blood oxygen saturation is less than 93, but respiratory rate is not increased. There are no obvious respiratory distress syndrome symptoms. Patient is happy without any discomfort, but his oxygen saturation may be very low. This condition is called as happy hypoxia, which is a feature of this COVID-19. In critical disease, there are respiratory failure, septic shock, and multiple organ failure or multiple organ dysfunction, MOD or MOF. Typical symptoms, major symptom is obviously fever. In early phases, it is fever and cough. In late, it is breathing difficulty with mild pneumonia, and complications may be hypoxia, pneumonia, acute respiratory distress syndrome, and most importantly, coagulopathy. Initially, it was thought to be a sort of pneumonia, but the coagulation pattern in COVID-19 is very different from other diseases, other pneumonias. Here, the coagulation of blood occurs at alveolar level, terminal level, and then there is typical ground glass appearance in the X-rays, and there is fibrosis of lungs. Uh, Common symptoms are chills with shaking, myalgia, headache, sore throat, new loss of taste or new loss of smell. This is a very important symptom. Usually it is loss of taste as well as smell. And in very few conditions, both taste and smell are lost. COVID-19 is one of them. And this is a very mm, important symptom for screening. In screening the populations, this symptom should be looked at. Obviously, pulse oximeter reading or SpO2 is mm, one of the best screening uh, criterion. There is also associated anorexia, loss of appetite in 40 to 84% of cases. Fatigue. Fatigue is very prolonged. Even after COVID-19 patient is recovered from COVID-19, fatigue continues for months together. Excess sputum is uh, found in one-third of cases. Atypical symptoms may include confusion, hemoptysis, vomiting, nausea, diarrhea, and rare symptoms like skin eruptions are seen. Recently, there was a WhatsApp message circulating, being viral, that only two things which cannot happen in COVID 19 are pregnancy and fracture. And one of my friends replied to that, that due to lockdown, pregnancy is also a complication of COVID 19, and fracture is also possible because of the sedentary kind of things. And when there is um, disinfection, disinfectant sprays used, there are chances of the person sleeping on mm, the floor and getting fractures. So almost any symptom can be seen in COVID-19. The frequency of symptoms was investigated in China very early. And here we can see that almost all symptoms, acute respiratory distress, type 1 respiratory failure, cardiac injury, with or without history of cardiovascular disease or hypertension. Usually, cardiac injury, there was a tremendous difference between the frequency in dead and frequency in recovered patients. So, cardiac injury is serious threat to the life of the patient. Heart failure, that was probably the cause after respiratory failure. Then sepsis, acidosis, alkalosis, acute kidney injury, intravascular coagulation. That is a big feature in COVID-19. Blood clots inside the vessels, capillaries as well as big vessels. And obviously all the complications resulting from such clots. Hyperkalemia was observed in many of the deaths. Shock was present in almost all the cases. Acute liver injury was also found in some cases, and GI tract bleeding was seen in one case. This was published on March 26th. Now the pattern may have changed, but this was very early uh, paper, and it shows a pattern of injury. According to Ayurveda, it seems more like dhatu dushti, and my personal observation is when this dhatu dushti reaches Medha dhatu, patient goes critical. So up to Rasa Rakta Mausa, patient recovers nicely. When it goes to Medha dhatu, there are the chances of death increase dramatically. Now, various therapies have been also tested statistically. Antiviral therapy, as you can see, antiviral therapy was a failure in almost one third of the cases. So, antiviral therapy was not much useful. Virtually no therapy was very useful, as you can see from this table. This is again from the same paper. Therapies used were antiviral, glucocorticoid, antibiotics, immunoglobulin, interferon, oxygen treatment. Even oxygen treatment was high flow nasal cannula oxygen was also not sufficient. Dialysis was also not useful. Extracorporeal membrane oxygenation, that was also not useful. So this is the general picture. There is exposure to SARS-CoV-2. Now this exposure may be by going to a crowded area where droplet infection is there, or there are some patients who are called as super spreaders. Usually, one patient will infect two other patients, whereas super spreaders, one patient will infect 10 other patients. In typical, there are two events where these super spreaders have emerged. First was a group of people going from Wuhan to Europe, and in this group, out of 10, 8 were super spreaders, and they spread this virus very rapidly to Europe. In India, the same thing, of course, it is yet to be published or established, but the Tablighi uh, Jamaat convention was studied with super spreaders. Now, after exposure, there may be no infection or infection. If infection is there, it may be asymptomatic, mild, moderate, or severe. Usually, in mild and moderate, there is recovery. In severe, there may be recovery or there may be death. Now, immunity is the main mm, key to survival from COVID-19. When immunity is strong, usually the disease doesn't progress to severe. But when there is immune dysregulation, the chances of death increase dramatically. And here, what happens is acute inflammation, particularly of alveoli. Then there is cytokine storm. To control the infection, there is a dialogue between various cells inside the body. And this dialogue is through a class of chemicals called cytokines. Now, these cytokines give signal, send signal that here is infection. Please come and control it. Then T cells come, then they form antibodies. Um, Natural killer cells come, they attack um, the infecting particles like viruses or bacteria. What happens in COVID-19 is even after this chain is complete, means natural killer cells have come, they have uh, eaten the cells with virus and dissolved that virus. But the signal has not stopped. Cytokines are continuously on. Means it's like burglar alarm. We have burglar alarms on cars. If somebody who doesn't have a key opens a car door, usually there is beep beep sound, alarm sound, which is continuous. Now, when such alarm is sounded, the owner comes to the car and stops the alarm after catching the offender. Now, in this case, what happens is the owner is unable to stop the alarm. Cytokines are continuously released. So, the situation is cytokine storm. And once cytokines are triggered, cytokines are released, more and more killer cells will come. And this causes acute lung injury, which results in acute respiratory distress syndrome, coagulopathy, and multi-organ system dysfunction. The inflammatory response is so great, continuous response, that it is something like we are using a cannon to kill a mosquito. And that is the primary cause of death in COVID-19. Autopsy findings in China and European countries show that there is endothelial damage to pulmonary vasculature, microvascular thrombosis and hemorrhage. It is linked to extensive alveolar and intestinal interstitial inflammation. Then this vasculopathy in COVID-19 is novel, so it is termed as COVID-19 vasculopathy. I am not going to go into details of uh, how this is distinguished from other vasculopathies. Intravascular, pulmonary intravascular coagulopathy, hypercoagulability, ventilation perfusion mismatch. Means we are supplying oxygen in large quantities, but it is not reaching the tissues. That is ventilation perfusion mismatch. And the acute respiratory distress syndrome, which is refractory, not responding to any kind of treatment. So, what is the reading? What is the interpretation in Ayurveda? There is one mm, very important paper about this. I'm, I have taken the conclusions from this paper. COVID-19 is an unlisted type of Kapha Vata Pradhan Sannipata Jwar. Features do not match exactly with description of any specific Sannipata Jwara, though it exhibits characteristics of Sannipata Jwara in general. All three doshas are involved, that is found in uh, patients. So Ayurvedic diagnosis is a type of Vata Kapha Pradhan Sannipata Jwara with Pitta Anubandha. Uh, the Sannipata Jwara described in classical texts, only the Kantha Kubja Sannipat is uh, very near to uh, COVID-19. Kantha Kubja Sannipat is described in Yoga Ratnakar and Bhav Prakash. From etiological perspective, it is obviously of exogenous origin, Agantu. This was published in Journal of Ayurveda and Integrative Medicine. Author Vaidya Ram Manohar. The important feature of this paper is this is based not on speculation but on actual examination of COVID-19 positive patients which were admitted to Medanta Hospital, and these were evaluated by Vaidya Ram Manoharji, and he has published this paper. Now we come to ICMR guidelines for mild COVID-19 cases. As as we go through these ICMR guidelines, there is nothing definite. Symptomatic treatment like paracetamol for fever and pain, antidepressants for cough, adequate nutrition and appropriate hydration, that is general management principle. Hydroxychloroquine, this is still on ICMR website. Hydroxychloroquine has been considered for high risk patients, but it is not found to be very useful. It should be given under strict medical supervision and preferably after shifting to uh, district hospital, district corona hospital. Uh, Avoid hydroxychloroquine. This is said by ICMR. Avoid it with underlying cardiac disease, history of unexplained syncope, or QT prolongation. That means you have to take an ECG, and if there is the distance between Q wave and T wave is greater than 480 milliseconds, then it is prolonged QT, and in that case, HCQ is not to be given. Now, for moderate cases, symptomatic treatment continues. Adequate hydrogen continues. Oxygen support. The target SpO2 is 92 to 96% and 88 to 92 in patients with COPD. The device for administering oxygen may be nasal prongs, mask, mask with or without reservoir bag, high flow nasal concentration or nasal cannula. HFNC uh, that can give very high doses of oxygen. Usually, with mask, we can give up to 15 liters. With HFNC, we can go up to 100 liters. Awake proning may be used as rescue therapy. So, what is awake proning? Patient undergo rotational change in position from prone to lying on each side to sitting up. For half to 2 hours, patient is in prone position, which is followed by the same amount of time in left lateral position, then right lateral position, and then upright sitting position. This change of position changes the gravitational profile of the lungs, and that helps. All patients should have daily 12 lead ECG. Anticoagulation, particularly heparin derivatives, are used. Antivirals, HCQ on first day followed by 200 milligram 1 BD for 4 days after ECG assessment. This is mm, something which is found to be not useful, but it is still in ICMR guidelines. Investigational therapies like remdesivir, which is recently found to be not effective. Convalescent plasma, this is the most promising kind of therapy. Recently, the ex-Chief Minister of Maharashtra, Devendra Fadnavis, received this convalescent plasma and has recovered and has been discharged now. But this convalescent plasma has also many restrictions. Means the antibodies in patient are not uh, durable. Usually after 90 days, mm, the antibodies go down to almost not detectable. And therefore, the window of collecting plasma is very small because patient after recovery is able to donate plasma for 1 month or so, and matching patient to the uh, plasma donor is a difficult task. For severe, again paracetamol antitussives continue, oxygenation continues, conservative fluid management, anticoagulation, heparin can be given. Here corticosteroids are recommended, and investigational therapy tocilizumab. This MAP in the name of the drug indicates monoclonal antibody. So tocilizumab is monoclonal antibody, and it can be given, may be useful, may not be useful. Interleukin 6 is an important marker of inflammation, and therapies directed towards interleukin 6 can be considered. Now we come to Ayurveda guidelines. Ayurveda guidelines are divided into various groups. For target group 1, it is quarantine and home isolation subjects with or without corona positive test and health workers. For them, preventive measures, contemporary guidelines, immunity enhancers, single drugs, formulations, lifestyle tips, and other general measures are prescribed in Ayurveda guidelines. For target group 2, it is mild or severe symptoms, comorbid immunocompromised condition. For various symptoms, there are guidelines. For comorbidities, there are specific guidelines. And also dietary advice is given. Third target group is vulnerable group, pregnant and lactating mothers, children, geriatric subjects. For them, rasayana therapy is recommended. Target group 4 is post-treatment restorative healthcare. Now, after the first wave of corona is waning, more and more cases of post-COVID complications are being seen. Post-COVID diabetes, post-COVID arthritis, many post-COVID illnesses are coming up, and Ayurveda guidelines give guidance about them also. Uh, Various formulations are given, dietary habits are is given, yoga practices are also recommended. For first line of treatment, various formulations are suggested. Mahasudarshan Dhanavati, Sanjeevanivati, Samshamanivati. I have found all these three as very powerful preventive medicines. Talisadi Churna and Yashti Madhu Churna, Sitopaladi Churna. Then for chewing or lozenges, Vyaushadivati, Lavangadi, Yashti Madhu Ghanavati are recommended. And for Kashaya, Chaturthaka Jwarahara Kashaya. There is Musta Amalaki and Guduchi. Then Pathyadi Kashayam, Guduchadi Kashayam, then Bharangyadi Kashayam. These are recommended by Ministry of Ayush. And these guidelines are available online at this website ayush.gov.in docs Ayurved guidelines. Ayurved, then dash guidelines dot pdf. You will get these guidelines online. Important from Agadtantra perspective are case report form. There is a specific case report form whenever you are handling a patient of COVID-19. You should use this case report form. The second important form is consent form. Again, it can be downloaded from this website. In all these guidelines, the only other formulation which is recommended is Bilvadivati, and that too only for Chwara. So, after seeing all these guidelines, we are now moving to the disposal guidelines. For disposal of dead bodies, standard infection prevention control practices should be followed. Hand hygiene, use of personal protective equipment, PPE kits are must. Water resistant apron, gloves, mask, eyewear, everything is essential. Very safe handling of sharp instruments is essential, particularly when we are doing autopsy. As far as possible, autopsy should be avoided. We are going to see autopsy guidelines a little later. Disinfectant, disinfected the bag housing dead body. Means after dead body is mm, uh, to be disposed, the bag should be disinfected first. Instruments and devices used on patients should also be disinfected. All linen clean and disinfect environmental surfaces. All surfaces should be disinfected. From isolation room, health worker should perform hand hygiene, ensure PPE kit. All tubes, drains, catheters on dead body should be removed. All puncture holes and wounds should be disinfected with 1% hypochlorite and dressed with impermeable material. Moisture should not be able to cross and virus should not be able to come out. Particularly intravenous catheters, other sharp instruments, they should be handled with caution and uh, they should be disposed in a separate sharps container. These precautions are very similar to autopsy of HIV/AIDS patient. Then plug oral and nasal orifices. If the family of patient wishes to view the body at the time of removal from isolation room, they can be allowed to do so with the application of standard precautions. Place the dead body in leak-proof plastic body bag. Exterior of body bag can be decontaminated with 1% hypochlorite. 1%
Sir,
hypochlorite is the
sir,
mm, yes.
sorry to interrupt you, sir. As we are lined up with another lecture, so can you please conclude in 5 to 10 minutes more?
Yeah, 5 minutes,
Okay,
not
okay,
more
sir.
than 5 minutes.
Okay, sir.
Yeah.
Continue. Okay,
Okay.
thank you.
Okay. So sodium hypochlorite 1% is an important disinfectant substance which is cheap, freely available, uh, and it should be used liberally. Uh, the plastic body bag can be wrapped in mortuary sheet or sheet provided by family members. Then it can be handed over to relatives, or in big cities like Pune, Mumbai, it is usually handed over to the corporation staff. Uh, okay, the precautions are essentially similar to uh, HIV. Biomedical waste management rules should be uh, followed, and the health staff will have to undergo 3-day quarantine after handling the body. Uh, there are some additional rules to for autopsy. As far as possible, autopsy should be avoided. If they are, if autopsy is required, then team should be kept minimum. N95 mask is an addition to all these. For only one body cavity at a time should be dissected. Unfixed organs may be held firm on the table and sliced with a sponge. Care should be taken to protect the hand. Negative pressure to be maintained in mortuary. This is important. Negative pressure ensures that if there is any accident in the mortuary, the virus doesn't escape the mortuary. For bone extraction, oscillators saw with suction is to be used. Hand saw with chain mail glove can be used. The primary aim is reduce aerosol generation, particularly when handling lung tissue. So these are important precautions in autopsy. And after the procedure, body should be disinfected again with sodium hypochlorite placed in a body bag. Exterior of body bag should also be disinfected with sodium hypochlorite, and then can be handed over to relatives. Autopsy table cannot be used immediately afterwards. Also has to be disinfected. Now, in this particular epidemic, we have come across a new invocation of a very old act, Epidemic Diseases Act, 1897. State or central government can invoke these laws. Perception of threat of epidemic by state or central government is sufficient to invoke. There is also a requirement that uh, center or state government should feel that ordinary provisions are not sufficient to control the epidemic, and the act empowers to take temporary measures. These are not permanent measures, these are temporary measures, and state or central government can empower any person or class of persons for inspection, quarantine, and isolation of people. Um, in epidemic diseases amendment ordinance, which was proclaimed in 2020 in full epidemic, uh, it made amendments to epidemic act. It applied to the whole country, including Jammu and Kashmir. Protection to health workers against violence is a feature in this amendment. Offender can get fine or imprisonment. Fine is 50,000 to 2 lakhs. Imprisonment from 3 months to 5 years. If the health worker has suffered grievous hurt, then fine increases from 1 lakh to 5 lakhs, and imprisonment from 6 months to 7 years. Offense is cognizable and non-bailable. Trial should be continuous trial, and maximum duration of trial is 6 months. Investigation should be completed within 30 days. Important is, if there is grievous hurt, then presumption of guilt is there. In Indian law, usually it is presumption of innocence. But in this ordinance, it is said that खटला जो अगर दावा दाखिल किया तो उसका मतलब है ये आरोपी गिल्टी है. अभी आरोपी को ये साबित करना है कि वो गिल्टी नहीं है. So burden of proof for not guilty is also on the accused. Insanity can be used as defense, but burden of proof of insanity is on accused. Damages of damages for grievous hurt are double the market rate for property damage. Now we come to the last part of the presentation. There are various vaccines. About 100 vaccines are candidates under trial. WHO is working in collaboration. WHO is preparing for vaccination of large number of people, billion of people, through ACT accelerator, that is the vehicle. COVAX will be the effort to facilitate equitable access and distribution of these vaccines to protect people in all countries. Priority will be given to people most at risk, that means health workers. Now, vaccines are of various types: inactivated or weakened virus vaccines, protein-based vaccines, viral vector vaccines, and RNA DNA vaccines. Just today, we are having news that Pfizer has developed a vaccine which is effective mm, 90% successful, and this is mRNA vaccine. So with this, I finish my presentation. Are there any questions?
Yes, sir. Uh, Sir, can if the COVID-19 spread increases through living organism, can we term this as a jangam wish? Other
Uh,
than human, if the spread is increased, can we term it as a jangam wish? Is the question in the
no,
comment
no,
section.
no. I have dealt with it in the slide that
Hmm,
Jangam we cannot label it as Jangam
hmm.
because it is not directly spread through any animal.
Okay,
It its origin is from bats, no
okay,
doubt, but the spread is something different, and it is through aerosol, so it cannot be termed as Jangam.
okay, sir. So there is one more question that you said the more the dhatu rushti, the critical is the situation, and when it specifically reach to medo dhatu, the patient becomes critical. So what is the significance of medo dhatu rushti? Can you correlate or explain, enlighten more on this?
Yeah, when I studied the autopsy reports of COVID patients, um, the kidney damage, the
Okay.
pathology seen in kidney damage is
Hmm.
that of medodushti.
Okay.
Uh, and Vurka is one of the Moolasthana of Medodhatu.
Yes, sir.
Uh, means that is the tipping point.
Okay, sir.
Uh, until Medodhatu is affected,
Yes.
patient has less risk. When Medodhatu is affected, then patient becomes serious and uh, risk of death increases. Yeah.
Okay, sir. Thank you, sir. So these are the only questions. Now I ask Mamta Narvekar, madam, to please continue the session.
Okay. Thank you, Zubekar sir, for putting light on various guidelines for COVID-19 and sharing your thoughts of wisdom with reference to classics of Ayurveda and COVID-19. Now, moving to the next lecture, our next speaker is Dr. Amol Kadu sir. Welcome, sir. Dr. Amol Kadu sir. Hello.
Uh, Sir, you can unmute yourself. Amol Kodu, sir.
Am I audible?
Yes, yes, sir.
Yes,
You are
yes.
audible.
Yes, you're audible.
Okay. Uh,
Welcome, Amol Kadu sir. Sir will deliver the lecture on topic Garavisha, underestimate hetu for understanding the Samprapti of various diseases in contemporary period. So let me introduce him in brief. Dr. Amol Kadu is presently working as assistant professor at National Institute of Ayurveda, Jaipur. He has a very bright academic career. He has contributed two chapters in the book Handbook of Visha Vigyan. He is a member of editorial board of Journal of Indian System of Medicine. He has participated in number of clinical projects. He has published many articles in national and international journals. So I request Dr. Amol Kavi sir to start the lecture.
Sir, Amol sir, you can start. प्रशांत सर अमोल सर आता जे पण आपले स्पीकर आहेत ते स्टार्ट करतायत तर त्यांना स्क्रीन शेअरचं ऑप्शन द्या.
Actually, I opened my PowerPoint presentation. पण केलाय मी.
हा हा सर यू आर
Am I
yes yes
visible?
sir you are visible.
Yes, yes, your screen is visible, sir.
माझा दिसतोय ना फोटो, धन्वंतरीचा
हो,
फोटो
sir,
दिसतोय
sir,
ना?
yes, your
Oh,
screen is visible. You can continue. Your voice is
ओके
also audible.
ओके ओके, थँक्यू थँक्यू. So, first of all, good afternoon to all. Today it is my honor that today, after Dr. Jogdekar sir's lecture, I am going to deliver the lecture in this national webinar. Namaste Jogdekar sir, respected Jogdekar sir. On this note, I would like to express my thankfulness to the Dr. G.D. Ford, Chairman of the Dr. G.D. Ford Foundation, YMT Ayurvedic Medical College, Kharghar, Navi Mumbai, Dr. Sanjeev Yadav, sir, who is the principal of this institute, the organizing secretary for this of this webinar, Dr. Sanjay Nandedkar, sir, the coordinator team, Dr. Mamta Narvekar ma'am, Dr. Swagat Patil, Dr. Viraj Kedkar, and Dr. Mayuri Hankare. Thank you so much for giving me this opportunity. And lastly, my friend, Dr. Premanand Bhalerao, who thought that I could share something different on this topic. And that's why he called me and given me this opportunity. So I thankful to him also. On this note, I would also thankful to our respected director, sir, of our institute, Dr. Sanju Sharma, sir, who provide me all the help for this presentation, and my head of the department, Dr. Anita Sharma, ma'am, and other colleagues. So, without wasting much more time, and with this vote of thanks, I continue my presentation. सो सर्वप्रथम विद्या की देवता और भगवान गणेश जी को और भगवान सरस्वती जी को मैं वंदन करता हूँ, और भगवान धन्वंतरी को भी मैं वंदन करता हूँ. एक मिनट, इज इट नॉट, is it visible now?
Yes, sir. Yes, sir. Your screen is very well visible.
Okay, okay, okay. So with this I will continue with my presentation. So ये सब हमारे गुरुवर्य जिससे मेरी आयुर्वेदिक बेस जो है वो मेरा बना हुआ है. तो आज हमारे माधव कुलटकर सर, धर्माधिकारी सर, जमदग्नि सर, एल महादेवन सर, Rasik Pavaskar sir, Mehetre sir, B.M. Hegde sir. All these are and other all gurus through whom I can understand some basic principles of the Ayurveda. So naman to all those gurus. So as you all know that myself, Vaidya Amol Kodu, presently working as a lecturer in the PG department of Agadtantra at National Institute of Ayurveda. And today I'm going to highlight, or I'm sharing my view on this topic, that is Garavisha as an underestimate hetu for understanding the samprapti of various diseases in a contemporary period. This topic is very much close to me because when I got an admission in the subject of Agadtantra, these are the basically areas where there is a much more need to exploration, and that's why it is very much close to me, and it is very much relevant also in today's perspective period, because we all are embedded in a test tube of a toxins, and everyone, you all know that we are exposing to the n number of mild potency toxins, and whether it is intentionally or unintentionally, we are consuming those things, these mild potency toxins through the different routes, whether it is a dermal route, whether it is a inhalation, or whether it is an ingestional route, and other routes also. So it is very, very relevant to understand what is the fate of these toxicants in today's contemporary period, and what in ancient time these mild potency toxins has been dealt. So it is very, very essential to understand this concept and its role in understanding the Ukta and Anukta praptis in present contemporary period. As you all know that nowadays there are lots of prevalence rate have been increasing regarding the cancers, autoimmune disorders, hormonal disorders, psychosomatic disorders. So in these things, we have to understand the role as a hetu for understanding this samprapti, because nowadays the hetu skand is different. what the Hitu Skanda mentioned in the ancient text, particularly in Charak Sushrut Vagbhat, that has been mentioned at that time. But now the scenario has been completely changed, है ना? तो अभी हेतु स्कंद बहुत ज्यादा बदल चुका है. पहले के जमाने में जो हेतु थे वो आज नहीं रहे हैं. तो it is a need to explore the different forms of the hetu, and in which Garavish also plays a very important role, and that's why this topic is very essential for the exploration. Now, before going to start, before coming to the main, I just highlighting certain cuttings which reflects that how this tendency of the adulteration and contamination is increasing and dividing. And that's why I'm just going to reflect certain cuttings which has been published in various news. So this is the one cutting which reflects कि 4000 किलो या दाल के साथ 30 लीटर रंग पकड़ा. Now there are so many bad practices are going nowadays where the peoples, अब अधर इतना ज़्यादा बढ़ गया है कि लोग for getting a maximum yield and for getting a maximum profit, the people do a lots of malpractices. Here the peoples are most of the peoples or the जो व्यापारी लोग होते हैं ये क्या करते हैं कि अलग-अलग colors जो है they are mixing with this दाल. जैसे कोई खराब क्वालिटी की मूंग की दाल है उसको कलर से पॉलिश कर दिया और अच्छी पॉलिशेबल मूंग दाल आपके सामने प्रेजेंट कर ली. तो दाल तो बेसिकली 30 किलो की है लेकिन उसको कलर लगा के उसको 80 किलो में बेच दिया या बेचते हैं. दीज आर कॉमन प्रैक्टिसेस. वैसे ही नाउअडेज देयर इज अ व्हाइट शुगर. पुराने जमाने में आती थी वो बहुत इतनी white नहीं रहती थी. Nowadays it is a processed sugar, and this process basically takes place through the different types of the chemicals, and these chemicals particularly is not manifesting as an acute manifestation. These are the mild potency toxins basically, and we are consuming in day-to-day life. So this is the practices going on around our society. Now this is another cutting which reflects that chemicals and malt used to shine the poor quality almonds. अब बादाम को भी इन्होंने छोड़ा नहीं है जिसको वो मतलब अलग अलग केमिकल्स और मर्ड का यूज वो करते हैं फॉर शाइनिंग द पुअर क्वालिटी almonds, and we are consuming such considering it as a high quality almonds, but basically we are consuming the chemicals and the merds which is applied on the outer cover of the almonds. This is another cutting which shows that plastic से शरीर में पहुंचे 29 जहरीली chemical. Now this plastics also a very important mediator which consists of lots of chemicals, and nowadays we are using everything in a plastic environment basically. So it consists of so many toxins, and indirectly we are consuming that things. Even the food items, I think nowadays every food item has been contaminated. See the paneer, मावा, दूध, sauce, शरबत, chocolate powder, सब में गड़बड़ी है ना? सभी में अलग अलग प्रकार के कलर्स जो है वो मिक्स किए जा रहे हैं. वेजिटेबल सॉस आपको पता ही होगा कि we are using in day-to-day life the tomato sauce and other sauce also. Nowadays this sauce also has been prepared by mixing with this starch, colors, and contaminated water also. So this is the things. Even the paneer, we all consume the paneer, and there is also a lots of contamination. Even the kali mirch. Now the medicines also has not been left out. That also polished with the different colors and sale in the market particularly. So even the medicines also not been left from this contamination and adulterations. Even the kaju you just visit and they just serve the cuisines of the different kaju containing cuisines to us or juice to us at a very low cost. Possible that kaju का भाव कितना है real अगर अच्छा quality का kaju अगर हम देखेंगे तो it is not possible to give the particular subjects which consist of this kaju at a very low cost. So it is all the low quality kaju has been used, which is properly furnished by using these acids. So most of the places, this low quality kaju has been supplied, which is get polished by the acids. Even the pickles are there. So after seeing these cuttings of the newspapers, we have to retrospect that what is going in the society. So चरविमान अध्याय 3 में कहा गया है कि सभी व्याधियों हेतु जो है वो अधर्म कहा गया है. एंड नाउ डेज इस कलयुग में अधर्म ये बहुत ज्यादा बढ़ गया है, और इस अधर्म की वजह से ही लॉस ऑफ कंटामिनेशन एंड लॉट्स ऑफ अडल्टरेशन हैज बीन practicing in a much more quantity, and that's why we are exposing to the n number of toxins, and that's why we just swimming in the in this sea of the toxins and the chemicals particularly. And that's why it is very important to explore this concept of the Garavisha, what exactly mentioned in Ayurveda, and in today's perspective period, what could be the possible forms of the Garavishas or the combinations we expose in day-to-day life. So that is very essential to understand all these things. और being as a वैद्य, हमें हेतु जब तक पता नहीं होंगे तब तक हम निदान परिवर्जन चिकित्सा ये नहीं करेंगे. तो हेतु समझना बहुत जरूरी है. हेतुत्व को और गर्विश के हेतुत्व को अगर आपको समझना है तो यू हैव टू आइडेंटिफाई द एक्सपोजर ऑफ दीज काइंड्स ऑफ द गर्विशा इन प्रेजेंट कंटेम्पररी पीरियड. बिकॉज गर्विश का जो कंसेप्ट आयुर्वेद में कहा गया है, चरक सुश्रुत वाग्भट ने जो वर्णन किया हुआ है वो उस जमाने का था. आज के परिप्रेक्ष्य काल में गर्विश क्या क्या हो सकता है ये समझना बहुत बहुत ज्यादा जरूरी है. And that's why it is very essential to explore the concept of Garavisha through Ayurveda. Now, I am not going in detail about the Nirukti, the meaning of this Gara, particularly of a diluted or the reduced potencies. So, Gara potencies particularly. So, in ancient time particularly,
Hello.
this is
Hello, sorry to interrupt you, Kadu sir.
Practices.
Your voice is cracking.
Different Gara formulations or the different. Yes.
Your voice is cracking a little bit.
Hello.
Your voice is.
Am
cracking.
I audible now?
Yes. Yes.
Is it clear now?
Yeah. Yes, sir. Is it clear now?
Okay. So should I continue?
Yes.
Okay. So in the ancient period, as you all know that most of the in the ancient period particularly, the administration of the different forms of the Garavishas is particularly parts are being used or had been used particularly. But these are the practices at that time to control our enemies and to make a person under our control. So that kind of a practices occur in an ancient period. The same things are also going at present time also. You know the chapter of this Adhen Suman who claims that the Kangna Ranot mixes the menstrual blood in the food. So it's persists today also. So that is not a new thing. Okay. So that is the most important thing that we have to explore the concept of Garavisha, what Ashtanga Sangrahkar or Charak or Sushrut opines about this concept of Garavisha. So let's see what mentioned in Ashtanga Hridaya or Ashtanga Sangrah. I know you all are very well aware about this theoretical aspect, but it's
Hello, Amol sir.
yes.
Sir, your voice is in between, not audible. Hello.
Okay. Now, hello. Is it audible now?
Yes, sir. It is audible now.
Okay. So as in Ashtanga Hridaya and Ashtanga Sangra, it is mentioned that the Garavisha considered as a okay. And what is its effects basically? It's Hanti Yoga Vashen Ashu, Chirat Chatat, Shofa Pandu Udar Mada, Durnam Adin Karotiva. Now see the manifestations which is imparted by this Garavisha is the Shofa in
Hello? Hello? Hello, Dr. Kadu? Hello? Hello? Hello, Dr. Kadu? Your voice is interrupting.
Hello, am I audible? I think it is disconnected.
Ah,
Oh,
your screen
yes,
was
sir, you
not
are
visible.
audible. Now the screen is visible, but in between your voice is interrupting. Right now it is audible.
Okay. Okay, no issue, no issue, no issue. So the manifestations of the Garavisha is also varies. There are certain Gara combinations which may impart the acute manifestation, and there are certain Garavishas may responsible for the Chirat manifestations and the Chiratara manifestation. So कुछ गरविश ऐसे होंगे कि जो acutely आपको symptoms आपके शरीर में दिखाई देंगे. There are certain Garavishas or Gara combinations which may impart the latter manifestations. Okay, so it depends. Particularly, this manifestation may depend upon the particular the fate of that particular Garavisha, and even it is also applicable to the disease conditions. Like शोफ अभी कुछ कुछ गर्विश अगर शरीर में जाएंगे तो इट मे मैनिफेस्ट एक्यूटली कुछ ऐसे जैसे कुछ गर्विश हमारे शरीर में गए तो इट मे मैनिफेस्ट एज एक्यूट मैनिफेस्टेशन ऑफ एज अ शोफ or there are certain Gara combination which give the acute manifestation of the Pandu, or there are certain Gara combination which give the acute manifestation of the Udar Sampraptis also. So the spectrum of these Garavisha is very broad. And what the combinations they are using in ancient time, that is Nana Prani Angashamala Viruddha Ushadi Bhasmanam Vishanam Chalpa Viryanam Yogo Gara Iti Smrutah. Now, in ancient time, particularly they are using the different excretas of the different animals. At the same time, they are using the different body parts of the different animals. Even the Viruddha Ushadis and Viruddha Bhasmas also are commonly used. And particularly, see, they have just mentioned in a very short word, it is Vishanam Chalpaviryana. Now, the spectrum of these Alpavirya Vishas is very broad. It is beyond our limitations. In today's contemporary period, we have a lots of Alpavirya Vishas, and till today we are exposing to the n number of Alpavirya Vishas in day-to-day life, which we call as xenobiotics, particularly the mild potency toxicants. So like just I'm giving the example that how this Gara combination occurs in now in today's perspective period. Suppose we take an example of the pizza or a burger. There are lots of preservatives and the coloring agents has been mentioned, or the use particularly. So the coloring agent and the preservatives, they are mixed together, and there is a formation of the gara, and we are taking it unintentionally basically. At the same time, suppose there are lots of cosmetic products we are applying on our body, so that kind of alpaviri vishas, it get enter into the body through the dermal route, and such kind of a yog may be considered as alpavirya visha. So such a combination or such a yoga is considered as a gara in today's perspective period. Then ये क्या हो गया इसमें? Now, according to the Sushrut, if you see the Dalhana Tika, he has clearly mentioned that Anne Pane Danta Kashte Tatha Abhyangava Lekhane Utsadane Kashaye Cha Parisheki Anulupyane Stranshu Vastreshu Shayyashu Kavachabharunishu Cha Padapitheshu Ishteshu Gajavajina Jušteshu Cha Anneshu Nasmanjanadishu Lakshanani Pravakami Chikitsam Apyanantaram. And if you see the commentary of the Dallana, he has mentioned that these are the adhishthanas through which we can administer the Garavishas. So these are the particular mediators through which we can administer the Garavish. Now in ancient time, these are the certain mediators through which we administer the Garavisha. And what we have see in today's perspective period also, we use the different deodorants. Now these deodorants, which consist of the naphthalene, which is responsible for which particularly acts as a potent carcinogenic agent. So it comes in contact with the dermal root. In ancient time also, the Ussadan, the Parishek, the Anulepan, what does it means? That it is the mediators in which we can administer the Garavisha through the dermal route. So the things are same. Nowadays, the Garavishas only changes. In an ancient period, the certain different Garavishas has been used, or the Alpavirya Vishas has been used. Nowadays, the combinations has been changed, and we are exposing to the different combinations. तो हेतु स्कंद अगर हम समझेंगे तो पुराने जमाने में जो गरविश का हेतु स्कंद जो था, या गरविश के डिफरेंट जो गर फॉर्मुलेशंस थे वो अलग थे. आज के परिप्रेक्ष्य काल में गरविश के जो फॉर्मुलेशंस हैं वो कुछ अलग है. सो इट इज वेरी essential to understand the fate of the today's gara combinations. These are the different modes of administration of the Garavisha which has been mentioned by the Acharya Sushrut. Even in context of, even particularly the Sushruta in Kalpastan Adhyaya 8, he has been clearly mentioned that Yoge Nana Vidher Esham Churnani Garam Adishet Dushi Visha Prakaranam Tatha Chapi Anulepana. So in context of this, the Dalhanacharya, that is in his commentary in Nibandha Sagra, he has quoted the description of this Alambayan. The Shastra, he has clearly mentioned different means there is a description of the how to formulate the different Gara yogas. So उस जमाने में एक आलमबायन ऐसा शास्त्र था कि उसमें अलग अलग कीटों के अलग अलग पार्ट्स का यूज जो है वो किया जाता था. इवन the different excretas has been, he has mentioned, which produce a potent Gara yogas. So he has give a detailed description about the different animals and excretas and their different body parts, that how we can formulate the different Gara yogas at that time. And if that applies on the body, or particularly on the skin, that may have certain harmful effects on the body. Now, the opinion of Dharaka, I know that here I just want to quote the opinion of the Chakrapani, that he has mentioned the two types of the Garavisha. One is the Nirvisha Dravya Sayoga Kruta Garavishas, and there are certain Savisha Dravya Sayoga Kruta Garavishas, which is we call as a Krutrim Vishas. So these are the opinions which has been mentioned in our Ayurvedic text. Even there is a references has been found where it has been mentioned that Viruddham Apicha Aharam Vidyat Vishagaropamam. Now this Viruddhahara, there are 18 types of the Viruddhahara which acts as a Garavishas. Okay. Avastha Viruddha, just see as example how these act as a Garavisha. If the Amavibhut Koshta is there, and if you are taking the Kshira in Amavibhut Koshta, it acts as a Visha. So that is nothing but it acts as a Garavish also. So Viruddhahar can be considered as a Garavishas, and there are 18 types of the Garavishas, and it act like a Garavish. Even in context of the Viruddhahara, it has been mentioned that Deha Dhatu Pratyanaka Bhutani Dravyani Deha Dhatu Virodham Apadyante Paraspara Guna Viruddhani Kanichit Sayogat Samskara Aparani Desha Kala Matradhipicha Aparani Tatha Swabhavat Aparani. Now he has quoted certain different types of the viruddha, where he has particularly emphasized a swabhava viruddha. And what he gave the example in Chakrapani Tika, that is Visham. So basically the Sthavara, Jangamo and Krutrima, particularly the Garavishas also, they are basically Swabhavata viruddha. And Swabhavata viruddha किसके? तो दोष के विरुद्ध और धातु के विरुद्ध और मल के विरुद्ध जनरली ये विषय होते हैं. So whenever we are considering the different forms of the Gara combination, they have the Swabhava Viruddha quality, or they have act as a Swabhava Viruddha. And if you consider all these textual references, then you think that yes, there are infinite combination and permutation can be made. Like अब अलग अलग दिमाग के लोगों में अलग अलग गर योग बनाने की बुद्धि आ सकती है. कोई जो है कॉकरोच का पैर यूज करेगा, कोई जो है कॉकरोच का मुंह यूज करेगा, या कोई जो है पूरा का पूरा कॉकरोच ही यूज कर लेगा. कोई दूसरा व्यक्ति जो है वो कॉकरोच का पैर यूज कर लेगा और मेंस्ट्रुअल फ्लो मिक्स करके जो है वो गर योग बना लेगा. So there are n number of the combinations, or infinite combination and permutations, and it depends on the buddhi of that particular person, that how he or she prepares such kind of the combinations, and how she administer to the different routes also. Okay, so these are the Ayurvedic perspective of the Garavisha. Now we just see the today's perspective prevalence of this Garavisha, that is we can consider the xenobiotic as a Garavish. The different opinions I'm not saying that this is my opinion or this is my understanding. You have a different opinion, and the different opinions are always welcome. And at the end of the presentation, we will definitely discuss on these things. But this is my thinking, and this is my view, and which is I'm going to present. So xenobiotics, as you all know, that it is a very important concept in a modern science, that whatever the stranger or the foreigner or the guest or the thing which is not familiar to the human body is called as genos, and bios means of or pertaining to the life, means which is harmful to the life. So any foreign material or any stranger thing which is not habituate to the body or which is not pertaining to the life is considered as a xenobiotics. And what are the Garavishas also? Kritrimam Garasaugyam tu. These are the man-made combinations. Particularly, these Garavishas are also the man-made combinations, which is also the foreigners, which is also stranger to the human body. Okay, so we can consider the xenobiotics as a Garavish. But the difference is that there are the individual chemicals or the individual xenobiotics are there. While in case of the Garavishas, there are the combinations. They have clearly mentioned that is yogo gara iti smrutah. So that is particularly a combinations. Okay. While in case of the xenobiotic, the individual chemicals are there, but there are so many incidences happens where two chemicals comes together and it forms the combination. So it may act as a, or it may be considered as a xenobiotics. So this is the concept of the xenobiotics in today's perspective of, or in today's contemporary period, which we can correlate with the Garavish. These are the sources of the xenobiotics. Like there are the different sources through which we can expose to the n number of the xenobiotics or the mild potency toxicants, like the agriculture field, where we are exposing to the different forms of the pesticides and the herbicides. Now we took the vegetables in our homes, and if it is not properly wash out, the minute portion of the pesticides and the herbicide may enter into our body. So it is get mixed through the food, and it enters into the body through the ingestional route, even the medicines. Now there is a big controversies on, yes, it is, as you all know, there is a positive science or the positive side of the allopathic medications, but still there are lots of side effects. So drugs or the medicines particularly, because of their anticipated beneficiary effects. Many allopathic drugs, they have the anticipatory beneficiary effect, but at the same time they have certain harmful effects also. Yeah, and for that, I think you all go for the B.M. Hegde sir's lecture that he always label the allopathic medication as a toxic pills. So, being as a cardiologist, being from the allopathic fraternity, he uh, he assumed that these drugs, if you are not using judiciously, it considered as a toxic pills. So we are consuming these kinds of the toxic pills of means for if you are taking it for a long period of a time, definitely it is it considered as a xenobiotics. The food industry now, we all are using now. There is no time for everyone because everyone is busy in our day-to-day life. No one are preparing the fresh foods. In America, in even particularly in India, हमारे भारत में at least सुबह का खाना और शाम का खाना तो बनता है, but in America, in the foreign countries, basically they are all using the additives and preservative contaminated food. The tiffin food they are particularly using. The cooking things or the cooking habits, it is vanishing, particularly in the foreign countries. Though it is still exists in India, but nowadays, if you see the IT industries people, they are not make such much efforts to prepare the fresh food at a morning and at evening also. So most of the peoples, they are exposed to these additives and coloring agents. Even the due to the industrializations, we are exposed to the n number of the toxicants, that is the carbon dioxide or the sulfur dioxide and other air pollutants, soil pollutants, and so many pollutants. There is one program has been telecasted by DNA on Z News, where he has particularly mentioned that we are taking so many air pollutants and which has been settled in a particularly in a cerebral hemisphere, which is responsible for the neurodegenerative changes. So these are the energy industries where we are exposed to the n number of air pollutants and which is responsible or which acts as a xenobiotics. Through the transport, we are exposing to the n number of air pollutants. The consumer industry, where we are exposed to the n number of plastics and coating dyes and other things. These are the types of the xenobiotics. I'm not going in details. There are certain exogenous xenobiotics and endogenous xenobiotics. So pesticides are there, chemicals are there, medications are there, n number of xenobiotics are there. If you see if you see the total prevalence of this Krutrim Visha in the present scenario, which is a man-made man-made Krutrim Vishas or man-made xenobiotics particularly. So processed and canned foods are there, preservatives and additives are there, food adulterants are there, different flavoring and coloring agents are there, artificial sweeteners are there, fruit ripening chemicals. This is a very common practices nowadays that we are using so many fruit ripening chemicals. Carbonated cold drinks are there, agricultural pesticides and fertilizers are there, polluted air, polluted water, different cosmetic products we are day-to-day life. There is a very beautiful lecture on YouTube by the B.M. Hegde sir, that how these lipsticks plays a very important role for the ovarian cancer. And even he made the request to the avian ministry that stop using of the lipstick or just the air hostess has to be avoid the applying the lipsticks on their lips because it is a major cause for the ovarian cancer. So these are the things which we have to focus particularly, and this plays a very important hetu for the different disease conditions. So for understanding the sampraptis of these anukta vadis like the cancers or the autoimmune disorders or the other anukta vadis, we have to first understand the fate of these forms of the xenobiotics and what its effect on the tridoshas, on the dhatus, on the srotasas, and other things. So it is very essential to understand the fate of these xenobiotics. So these are certain studies which has been I am showing that even the vegetables, it has been observed that there are n number of toxicants has been found, and we are taking these chemicals, low potency toxins, in a mild form in our day-to-day practices particularly. Even the refined oils, there are lots of process has been occur for making the refined oils. what we are using in a 80s and 90s. Nowadays it is completely different. There are lots of chemicals has been used in this refinery process, and we get a refined oil. Basically it is a chemical contaminated refined oil. So these are the different forms of the xenobiotics or the low potency toxins particularly, which may consider for the as a hetu for the different disease conditions. And it is a time to understand its effect on the tridosh, on particularly on dhatu, on the malas, and basically on the srutas also. So there is a there is a high time to understand its role in the framing of the sampraptis of the different diseases. So if you now come to the main part, that this is the just a theoretical portion, just I'm highlighting for understanding the hetutu of the Garavisha, that how this Garavisha can play the important role in the different disease conditions. Now, if you have to understand the hetutu of the Garavisha, we have to first understand, we have to first take a detailed history, and that's why in Ashtanga Hriday, or particularly in our ancient science, in particularly Ayurveda, it has been clearly mentioned that दर्शन स्पर्शन प्रश्ने ही परीक्षेत च रोगिणम. मतलब रोगी की परीक्षा अगर आपको करनी है, तो we have to examine that particular person by the darshan, by the sparshan, and prashna pariksha. So प्रश्न परीक्षा plays a very important role. Now आजकल ओपीडी में इतनी भीड़ होती है कि we don't have a time to take a detailed history about the विरुद्धार. अगर total patient की detailed history अगर लेते रहेंगे तो एक patient ही 1 घंटा 2 घंटा लेगा. But it is very essential to ask the different kinds of the questions, and even the exposure to the n number of the toxicants. That is the most important thing, that what he is going to practice in day-to-day life. So prashna pariksha plays a very important role. And for understanding the rog, कोई भी रोग अगर आपके पास आता है, चाहे वो विल्सन डिसीज हो, चाहे वो ओवेरियन कैंसर हो, चाहे वो autoimmune disorders. So there are so many anukta vadis nowadays emerging out, and it is not mentioned in an ancient text particularly, but we have to understand these anukta vadis, these new emerging diseases on the basis of nidan pragrup रूप लक्षण उपशयाप्ति भी. मतलब हमें इन निदान पंचक के बेसिस पे ही इन अनुक्त व्याधियों को समझना बहुत जरूरी है, एंड इन विच पर्टिकुलरली द निदान प्लेस एन अ very important role. Now there are certain dosha prakopak hetus has been mentioned, there are certain dhatu pradoshak hetus has been mentioned, and there are certain hetus nowadays, as we all are embodied in the test tube of toxins. So we are in day-to-day life, we are exposed to the n number of toxicants. So that also plays a very important role in the manifestation of the different disease conditions. Now, the relationship between the hetu and vadi, this is a very important thing. You all know that this is a very well quotation mentioned in Charak Nidan Adhyay 8, that the single hetu may be responsible for a single disease and a multiple disease, and even a multiple hetus plays a very important role to occur a single disease or a multiple disease. So hetu जो है, एक हेतु किसी एक व्याधि का भी कारण हो सकता है और अनेक व्याधि का भी कारण हो सकता है. और आज के परिप्रेक्ष्य काल में अगर हम देखेंगे तो देयर आर लॉट्स ऑफ हेतुस प्लेज एन अ वेरी important role for framing out the different sampraptis, in which the Garavisha can play a very important role, and we have to identify its role in a different disease condition. तो ऐसा जरूरी नहीं है कि सिर्फ दीवा स्वाप और रात्रो जागरण, दधी सेवन यही हेतु किसी व्याधि के लिए हो सकते हैं. गरविश भी आज के परिप्रेक्ष्य काल में हेतु जो है वो बहुत कॉमनली हो सकता है, और सभी डिजीजेस में मैं तो मानूंगा कि सभी डिजीजेस में गरविश ये रोल बहुत ज्यादा मायने रखता है. Now, for understanding the disease, doshas plays a very important role for all types of the diseases particularly. Now, dosha eva sarvesham roganam eka karanam, which has been substantiated by another references also, that sarva eva nija vikara na anyatra vata pitta kafebhyo nirvantanti. Whatever the disease or the framework of a patient comes to you, a particular different types of the patient comes to you, we have to understand that particular disease condition in context of dosha. because dosha is responsible for all types of the diseases, whether it is agantuj vadis or whether it is a nija vadis. And for that, इफ यू कंसिडर द निज वैदिस, कोई भी, और जैसे अभी कैंसर, एक कैंसर की संप्राप्ति अगर हम देखेंगे अलग अलग डिपेंडिंग अपॉन द साइट्स ऑफ द कैंसर, देयर आर द ओवेरियन कैंसर, देयर में लंग कैंसर, और देयर इज अ हेमेंजियोमा, देयर इज अ एक्यूट माइलॉइड लिम्फोमा, सो मेनी कैंसर्स आर देयर. सो वी हैव टू अंडरस्टैंड इन कॉन्टेक्स्ट ऑफ द dosha that particular things. And for this निज वैदिस पर्टिकुलरली, ये जितने भी वैदि है हम किसे कैसे कंसिडर करेंगे, एज अ निज वैदि हम कंसिडर करेंगे. एंड फॉर दैट निज वैदि देयर इज अ निजस्य तु मुखम वात पित्त श्लेष्माणाम वैषम्य. So there is a very very important thing, that is vata pitta shleshma vaishamya plays a very important role for occurring the nija vadis, whether it is the ukta vadi or whether it is anukta vadi. And how this vata pitta shleshma vaishamya occurs, that is also plays a very important role. अब ये वात पित्त श्लेष्म वैषम्य होता कैसे है ये भी जानना बहुत जरूरी है, और इसके लिए संप्राप्ति जानना बहुत जरूरी है. एंड व्हाट इज द डेफिनेशन ऑफ द संप्राप्ति, दैट इज यथा दुष्टेन दोषेन यथा च अनुविसर्पता निर्वृत्तिर आमयस्यासो संप्राप्तिर जातिर आगति. तो यथा दुष्टेन दोषेन, नाउ इट इज वेरीज फ्रॉम पर्सन टू पर्सन, पुरुषम पुरुषम विक्षम. कोई व्यक्ति जो है कोई व्यक्ति का गर्विश का एक्सपोजर या जिनोबायोटिक का एक्सपोजर कुछ अलग होगा, किसी व्यक्ति का कुछ अलग होगा, किसी व्यक्ति का कुछ अलग होगा. ठीक है. इवन द प्रैक्टिसेस, मतलब ये विरुद्ध आहार या विरुद्ध आहार हमें शरीर पे कब अफेक्ट नहीं करेगा, अगर कोई व्यक्ति स्निग्ध है, जो नित्य व्यायाम करने वाला है, जो साथ में आहार सेवन करने वाला है, ऐसे व्यक्ति को विरुद्ध आहार अफेक्ट नहीं करेगा. बट particularly the fate of this Garavishas, which enters into the body through the different routes, that has been vary from person to person, because everyone's practice दिनचर्या अलग, सब लोगों की अलग है, ऋतुचर्या सब लोगों की अलग है. ठीक है. सहज बल सबका अलग है, युक्तिकृत बल सबका अलग है. So the effect of this Garavishas, the effect of the xenobiotics or particularly different toxicants varies from person to person. और इसीलिए यथा दुष्टेन दोषेन यथा च अनुविसर्पता निर्वृत्तिर आमयस्यासो संप्राप्तिर जाति आगति. तो ये 3 स्टेजेस जो है संप्राप्ति की, ये समझना बहुत बहुत ज्यादा जरूरी है. आई जस्ट गिव हाउ दिस यथा दुष्टेन दोषेन, हाउ डज दिस हैपेंस. आई जस्ट गिव दिस एग्जांपल. Now take it the example of the क्षीर. Now this क्षीर से दधी बनता है, दधी से ही रसाला श्रीखंड बनता है. ठीक है. Now if you consider the क्षीर as the hetu, if a person who having the predominant of pitta and मृदु कोष्ठ क्षीरनपि विरेच्यते, ऐसे व्यक्ति को क्षीर क्या करेगा, विरेचन कराएगा. ओके. इवन द क्षीर हैज अ प्रॉपर्टी ऑफ अ कफवर्धन. अभी उसी क्षीर से अगर हम दही अगर हम बनाते हैं तो वो दधी अम्ल रसात्मक हो जाता है, अम्ल पाकी हो जाता है और ग्राही होता है. देखिए क्षीर जो है वो मधुर रसात्मक है, मधुर विपाकी है, शीत वीर्यात्मक है, लेकिन मृदु कोष्ठी के लिए वो विरेचन करने वाला है. उसी क्षीर से अगर हम दधी बनाते हैं तो अम्ल पाकी अम्ल रसात्मक है और ग्राही कार्य करता है, और उसका भी एक कफवर्धकत्व अलग है. और उसी दधी से अगर हम रसाला अगर बनाते हैं, श्रीखंड बनाते हैं, तो अष्टांग हृदय वाजीकरण अध्याय में क्लियर कहा है, अग्रय में कहा गया है कि ये रसाला जो है प्रतिष्ठा के लिए एक बेस्ट मेडिसिन, ये अग्रय दवा के रूप में कहा गया है. तो देखिए हेतुत्व जो है, एक्शन ऑफ हेतुत्व, इट वेरीज फ्रॉम द्रव्य टू द्रव्य. ओके. सो क्षीर दधी रसाला ये तीनों ही क्षीर से ही, एक ही जाति से बनी है, लेकिन कफवर्धकत्व अगर हम देखेंगे तो तीनों ही द्रव्यों का कफवर्धकत्व ही अलग अलग रहेगा. वैसे ही गर्विश की रिगार्डिंग भी वैसे ही मैं आई जस्ट कोटेड दिस एग्जांपल टू अंडरस्टैंड द फेट ऑफ द गर्विश, दैट इसी प्रकार गर्विश का फेट भी अलग अलग होगा. गर्विश की जो एक्शंस होंगी ऑन द दोष, ऑन द धातु, ऑन द मल, इट वेरीज and it may differ from different combinations. Like the same thing, samprapti is also here. I just want to highlight, I'm not going in detail. If you see the Pandurok samprapti, they have clear cut mention that katu rasa vivarjit amla lavan ras is responsible for framing out the Panduroga samprapti. They have not mentioned to katu ras in the Panduroga samprapti. Why? Because अगर कटु रस, देखिए अम्ल लवण और कटु ये तीनों ही पित्तवर्धक रस है. पांडुरोग की संप्राप्ति अगर हम देखेंगे तो पांडुरोगी पित्त प्रधान व्याधि है, पित्त प्रकोप से होने वाला व्याधि है. बट हियर दे हैव पर्पसफुली ओमिटेड द कटु रस. They have just mentioned the amla lavan ras, because कटु विवर्जित अम्ल लवण रस से ही अगर पित्त प्रकोप होगा, साथ में कफ प्रकोप होगा, तो ही जनरली पांडुरोग की संप्राप्ति होती है, अदरवाइज पांडुरोग की संप्राप्ति नहीं होती है. So they have the vision that there are certain hetutva is very essential for framing out the particular samprapti. Like in Rakta Pitta, they have mentioned all the three Pitta Vardak rasas, that is Tikshnoksha Kshara Lavanehi Amle Katubi Evacha. Here they have mentioned all the three Pitta Vardhaka rasas, which is responsible for the Pitta Prakop and which is responsible for the Rakta Pitta Samprapti. So this is the thing. Even if you see the Kamla Samprapti, that they have also mentioned that there must be a Vabhichari hetu must be there. That is Pandu rogi to yotyartha pittalani nishevate. Means Pandu rogi की संप्राप्ति अगर होगी, अगर नहीं भी होगी, लेकिन कफवर्धक मतलब अम्ल और लवण रस का सेवन करने के बाद जो संप्राप्ति बनेगी, उसके बाद अगर वो अत्यंत पित्तवर्धक आहार अगर सेवन करता है तो ही कामला की संप्राप्ति ये होती है. तो why I am telling all these things? Because yatha dushtena doshena plays a very important role. Though Pandurog, Kamala and Rakta Pitta all are of Pitta Vikaras, but the hetutva is different. Okay, so involvement of the Pitta dosha is same, but Samprapti varies according to the Yatha Dushtena Doshena. And these things we have to understand at each and every level. That is according to Dravya Pradhan Samprapti, Karma Pradhan Samprapti, Vikal Pradhan Samprapti, Anshansha Vedana Samprapti, we have to understand for each and every disease condition. Why I am telling all these things? Because it is very essential to understand the fate of Garavishas in different disease conditions. Because if Hetu change, the Samprapti also change. Even the Yathacha Anuvisarpata, that is also the main important thing. That Nidan, अब तक हमने निदान तो देखे, अलग अलग निदान जो होते हैं, it is responsible for the dosha prakopa. But when this kupita dosha get prasar, जब उसका prasar होगा, like in shakha, koshta, asti or sandhi, they are producing n number of vadis. So if you have to understand the sampraptis of the anukta vadi, we have to understand this path particularly. Okay, so at the same time, so I'm not going in detail that how this because due to the lack of time, it will take a much more time, so I'm not going in detail. But this is the thing that we have to identify the path, that yatha dushtina doshena yatha cha anuvisarpata nirvrittir amayasyasu sampraptir jagati anjatir agati. So when the different forms of the Garavisha get enters into our body, we have to understand their fate. Now come to the considering as Garavisha as a Hetu. Now there are scattered references in context of Garavisha has been mentioned in the Ayurvedic text, which state that there is a definite role in a different disease condition. Now in Ashtanga Hridaya, it has been clearly mentioned that the Garavishas plays a very important role for the dosha prakop, sannipata dosha prakop. It is responsible for the tridosha prakop. It is a major hetu has been mentioned for the sannipata dosha prakop. Even it has been mentioned as a dhatu pradushanakara dravya. Even as I previously mentioned that Visha is the example of the Swabhav Viruddha. So there are different forms of the Garavishas who have the Swabhavata Viruddha actions in according to the dosha, dhatu and mala also. So Garavisha considered as a dhatu pradushanakara dravya. Now if you see the Chakrapani tika of this dhatu pradushanakara dravyas, that dhatu pradushanam iti vatadinam samatvena sharira dharanatmakam tatha rasadinam cha dushanam kinchit yatha yavaka mandaka vishadi. Now if you see or if you consider the dhatu, here only not it is pertaining to the sapta dhatus. It is beyond that, means vatadi tridosh also considered as a dhatu, rasadi sapta dhatu is also considered as a dhatu, even the malas also considered as a dhatu. So if it get vitiated by these dhatu pradushanakara dravyas, it is considered as a dhatu pradushanakara dravyas, and in which in that context Chakrapani has mentioned the example of Vishadi. So Visha plays a very important role as a dhatu pradushanakara dravya. And why I am putting this? Because the n number of toxicants or the Garavishas, the combinations enter in our body, and it will be responsible for the Vatadi dosha prakop, it may be responsible for the Rasadi Dushti, it may be responsible for the Maladinam Dushanakaram, it may be responsible for the Srudasinam Dushanakaram. So it's our responsibility to understand the fate of the different gar combinations. जैसे अभी विनेगर हमारे शरीर में जा रहा है, डिफरेंट डिफरेंट कलरिंग एजेंट्स हमारे जा रहे हैं, तो वो शरीर में जाने के बाद उसका मेटाबॉलिज्म होने के बाद, या अगर मेटाबॉलिज्म प्रॉपरली नहीं हुआ तो वो किस स्रोतों पे एक्ट करेंगे, वो वातादी दोषों पे क्या एक्ट करेंगे, कैसे एक्ट करेंगे, वो रसादी सप्त धातुओं पे कैसे कैसे एक्ट करेंगे, दैट इज अ टाइम टू अंडरस्टैंड.
Hello, sir.
Yes.
Sir, try to conclude in 5 to 10 minutes as we
Yeah.
are we're running
Now the
out of.
fate of the, yeah, I just want to conclude. Now fate of the different Gara Yogas, these are the different combinations that when the different forms of the xenobiotics enter into the body through the ingestional, inhalational or the dermal routes, out of that there are certain xenobiotics or the certain combinations, they may be biotransformed, conjugate and excreted, and there are certain combinations they might be stored in the body and which may be responsible for the n number of a disease condition. Now the responses of this Garavishas or these xenobiotics in the body, it also varies particularly. Like there are certain independent toxicants in the body may act independently of each other, or there are certain toxicants may also affect the body's response to the other toxicants. मतलब कोई विनेगर अगर हम शरीर में ले रहे तो उसका कुछ हार्मफुल इफेक्ट कुछ अलग रहेगा. Okay. At the same time, if you are taking the preservatives or the coloring agents, it may potentiate the action of the other toxicants also. Even there are certain toxicants or the combinations or the color combination that may affect the body's normal chemical presence in the body. Okay. Even there are certain chemicals may act or interact in a number of different ways to produce their effects in the body. So it has the n number of things. So there are lots of toxicological studies have been going on where we are understanding its harmful effects independently. But when it get enter into the body, what it produces in the body, that is a different thing, and it is very difficult to understand at a subtle level. Now, what are the possible adverse effects or the toxicity of these Gara combinations in a today's perspective period? That it may be responsible for the biochemical pathway interruption, cell death, or the inflammation, or the receptor interaction, immunosuppression, mutagenic changes. It may imparts even the cancerogenic or carcinogenic actions also they have. So this is the realm of the xenobiotic activity in the immune system. Now, whatever the combinations or the foreign chemicals enter into the body, this is the process. The liver plays a very, very important role, and that's why it has been clearly mentioned that Visham hi deham samprapyam praga dusheti shunitam. So whatever the combination enter into the body through the lung, skin, or the any roots, the primary detoxification organ is a liver. And if you see the Moolava Srotas of the Raktava Srotas particularly, the mool of the Raktava Srotas is Yakrut and Kriya. And that's why the high burden occur on this liver. And there are certain fats, even there are fat soluble toxins and the water soluble toxins, and they have the different fats and its effects. Now, this is the another thing which is plays a very important role in the different sampraptis. Now, here in the Nijashota Hetu, the Garavisha, Garupasrashta Anna Nishevan plays a very, very important role for the Nijashota Hetu. And if you see the Udar, Arbud, Granthi, there are so many sampraptis which is basically gone through this Shotha samprapti, in which the Gara Visha plays a very, very important role. Even for the Sannipata Dosha Prakop, Garavish may mention as a main Hetu. For the Vishaja Shofa, Gara Yogas plays a very important role that when it comes in contact with the skin. Now, this is not only the external skin, and the dermal skin is not only responsible, even the mucous membrane is also considered as a tvaka. Okay, so that may also responsible for certain allergic disorders also. So Garasteva Churnanam, Advansanam, so that plays also responsible for the Vishaja Shofa. Okay, even for the Unmada Hetu, they have particularly mentioned that Viruddha Dushta Asuchi Bhojanani. Now, in context of the Madhukosha Tika, they have particularly mentioned that what is meant by Dushta, so Gara Sahitam Annadi. Even dushtam garadi atyarth doshajanakam cha, means here in Unmad Samprapti, they have highlighted that yes, the Garavishas plays a very important role in the pathology or in the Samprapti of the Unmad also. Even in context of the Sannipatodara, Garavisha plays a very important role. So these are the Garavisha Lakshanas. Now, whatever the different combination, when we are exposed, it is responsible for the Shofa, Pandu, Udara, Unmada, Durnama. These are the Ukta Sampraptis, Anukta and number. Now, it's our duty to understand these Anukta Sampraptis, and for that, we have a thorough knowledge of the different forms of the Garavishas. Even these Garavishas also have, or it vitiates the Agni also. Because if the Agni is the Agni Mulam Balam Punsa, it has been mentioned. तो अगर अग्नि प्राकृत रहेगा तो ही ये सब डिटॉक्सिफिकेशन प्रॉपरली होगा, अदरवाइज नहीं होगा. सो द गर्विश हैज अ हाई एफिनिटी टू डिस्टर्ब और टू विशिएट द अग्नि, and for that they have clearly mentioned in context of Garavisha Lakshana that tena pandu krusho alpagnihi. Even the next process is vayunam pratilomina, and what they have mentioned is mahodara yakrutapli. Now, if there is extra burden of the Garavishas on the liver, definitely it hampers the Shonita Mula Srotas, that is Yakrut and Pliya, which has been manifested in the symptoms of the Garavisha. Even if you see the Charaka symptoms, they have mentioned the major diseases like Zataram, Grahani Dosho, Yakshma, Gulma, Kshayo, Jwaraha, Evam Vidascha Annasya, Vyadhe Lingani Darshan. So these are the Ukta Vyadhis they have mentioned. Anukta n number, infinite number, and it's our duty to understand the role of the Garavishas in such kind of the Anukta Vyadhis. So these are the specific dreams associated with the Garavisha. I'm not going in detail. So whenever we are understand the Ukta Vyadhis or the Anukta Vyadhis with the help of this Trived Buddha Sangra, it is very important to understand the things. That is, we have to understand the Vikar Prakriti, we have to understand the Vikar Adhishtan, and the Vikar Samuthan. And in this Vikar Samuthan, we have to understand as we are exposed to the n number of the toxicants, which plays an important role for the dosha prakop, for the dhatu dushti, and for the sroto dushti also. And so for the last, this is the last slide, and for that, considering as we all embodied in the test tube of a toxins, and particularly we are exposing to the n number of the Gara combinations, it's our duty, it's a duty of the Vaidya to do, to incorporate the Visha Pratyanic Chikitsa also. And for that, we have to apply the Garavisha Chikitsa. It is not possible that it has been clearly mentioned that in context of Garavisha, we have to means Urdhva Shodhan is very essential. So whenever we see the treatment of any disease, it is of a Didopakramani, either Langan or Bruhan. Okay, in Langan also we have to apply the Shodhana procedures and the Shamana procedures. So whatever the disease we have to deal, we have to do the Chikitsa in a Didopakramaniya context. Okay, so Garavisha Chikitsa plays a very important role in all disease conditions as we are exposing to the n number of the toxins. And if you see the different Garavisha Shamana yogas, Suvarna Bhasma Prayog they have mentioned. So whenever you consider, because Suvarna Bhasma, it is a potent Balya, Rasayan and Rakta Shuddhikara Dravya. Okay, and whatever the vishas get enters into the body, it first vitiates the Shonita. So using of the Suvarna Bhasma Prayoga is very apt in our treatment protocol. Even the Suvarna Prayog, Suvarna Siddha Jala is also there, and even in a very complicated disease condition, the Suvarna Prayog, because Gareshu Hema Sreshta ऐसा वर्णन कहा गया है, श्रेष्ठ अग्र कहा गया सुवर्ण को. तो गरविश में सुवर्ण भस्म का प्रयोग हमें बहुत ज्यादा करना है. घृत, इट इज ऑल्सो प्लेज अ वेरी इंपॉर्टेंट रोल दैट सर्वेषु सर्व अवस्थेषु विशेषेषु न घृतोपमम, मतलब विष के सभी अवस्था में, सभी प्रकार की विषयों में घृत जैसा बेस्ट विषग्न द्रव्य कहीं नहीं कहा गया है. So it is high time to use the different medicated krutas in our prescription also, considering the avasthas of the patients and considering the different avasthas. Even we have to highlight the different formulations which are having the Vishagna property, like Tikta Grut. In context of Kushta, there has been mentioned as a Tikta Grut, which is indicated as a Garavishanashan. In a Kalyana Grut, in context of Unmad Chikitsa, Kalyana Grut has been mentioned. which is particularly indicated not only for the Unmad, but in its Falashruti, it has been mentioned as a Garavisha guna. So it's our time to use such formulations which are not only the dosha pratyanic, vyadhi pratyanic, but as well as the visha pratyanic action also, and particularly the Garavisha pratyanic action. And finally, the Nidan Parivarjana Chikitsa. If you don't identify the hetu, we can't do the Nidan Parivarjana Chikitsa. Like आपने अगर आप लोगों को पता होगा कि वैद्य गार्गिल सर अलग अलग कैंसर पेशेंट्स में, because there are n number of carcinogens plays a very important role for igniting the different cancer sampraptis, and basically that's why he has strictly mentioned कि भाई आपको देसी गाय का ही दूध पीना है, घर वाली गाय आपको लाना है, because the milk is also get contaminated, so we have to avoid that contamination. We have to avoid that carcinogen agents. Even वो ये भी कहते हैं कि आप धान्य भी जो है वो अपने घर में उगाओ और वही उसका ही प्रयोग करो, वेजिटेबल्स भी आप अपने घर पे उगाओ उसका ही प्रयोग करो. So he just try to avoid the nidanas, particularly in a cancer patient. So nidana parivarjana plays a very important role in such a condition. So identifying the nidan, and उसमें भी अलग अलग गरविशा को आइडेंटिफाई करना, it's a duty of today's Vaidya, and then if we incorporate the dosha pratyanic chikitsa, vyadhi pratyanic chikitsa and visha pratyanic chikitsa in his prescription, then he will become a kushala Vaidya and manage the different disease, anukta disease conditions. So thank you for patient listening. So if you have any queries, you may ask, and again thankful to the organizers who have given
Yes,
me the opportunity to share my
sir.
views on this topic.
Sir,
Yes.
can you enumerate one or two dietary habits which people are unknowingly following that can be termed as Garavish Hetu in contemporary period?
See, like the avastha viruddha, see, this is the one quotation has been mentioned in Ashtanga Hridaya that amavi bhuta koshtasya kshiram eva visha ahiva. That means कि if there is amabhyut koshta, अगर जीर्ण आहार अगर नहीं होगा, that prasrushta vinmutre rudisu vimane, these are the symptoms which has been mentioned
Okay.
in context of मात्रा शीतीय अध्याय. तो जीर्ण आहार के लक्षण अगर आप आपके शरीर में नहीं दिखा रहे, अगर आपको 2 दिन के बाद मतलब 2 दिन आपको लैट्रिन ही नहीं आ रही है, आपको प्रसृष्ट विनमूत्र हो ही नहीं रहा है, and still we are taking the breakfast in early morning, it is avastha viruddha. Okay. So if
Okay.
you are even, there are so many patients who having the amavibhut koshta, but still they are taking they are consuming the milk particularly. So that is
Okay.
the things which act as a garavish.
Okay, sir. Thank you, sir. That's the question only. I ask Dr. Mamta Navika madam to continue. Hello.
Hello.
हाँ मैम.
Thank you, Dr. Amal Kadu, sir. I must mention our deep sense of appreciation for your views on Garavishi in today's perspective. Now I request Dr. Sanjay Nandekar, sir, head of the department and professor of Agadtantra department, to conclude both the lectures.
आवाज येते का?
हाँ, येतोय सर आवाज.
Hello.
हाँ, बोला सर, आवाज येतोय.
I would like to express our sincere thanks to both speakers, Dr. Vishnu Jagrekar sir and Dr. Amal Kadu sir, for giving excellent coverage to new lines of approach to Agadtantra. I also like to thank all delegates for joining us on today's webinar. We have been fortunate enough to be backed by management of Dr. G.D. Foundation. I thank them for providing encouragement. I also wish to express our sincere thanks to our chairman, Dr. G.D. Professor, Dean Dr. Sanjay Yadav sir, and Vice Principal Dr. Ninath Sate sir for their support. Thank you all once again, and I declare the session is over.
Thank you, Nandekar, sir, for giving a vote of thanks also. So it's a great and it was a pleasure experience. Thank you, everyone, and we appreciate you being here. Thanks again for joining us today, and we will see you next time. Have a good day.
गैप बना देगा।
चलो, थैंक यू पटेल जी। आज